Today we will be learning about compassion fatigue. Compassion fatigue is a state of physical, emotional, and spiritual exhaustion that can occur when people are exposed to traumatic situations for an extended period of time. It is often experienced by individuals in the helping professions, such as veterinary workers, healthcare workers, social workers, therapists, and counselors who are working with people who are suffering from trauma. It can also affect people who witness traumatic events, such as mass shootings or natural disasters. Common symptoms often develop gradually and can affect both physical health and emotional well-being. Physical exhaustion is one of the earliest signs and may present as persistent tiredness even after adequate sleep, heavy limbs during long shifts, or feeling drained before the workday has even begun. Veterinary nurses may experience burnout, where the emotional and physical demands of caring for animals, supporting distressed clients, and managing high workloads begin to feel overwhelming rather than meaningful. Irritability and frustration may show up in everyday interactions, such as feeling unusually short-tempered with colleagues, becoming easily annoyed by routine requests, or struggling to remain patient with anxious or demanding clients. Difficulty concentrating is also common and may be noticed as forgetting small details, second-guessing medication calculations, struggling to follow treatment plans, or finding it hard to stay focused during procedures or consultations. Compassion fatigue can also manifest through physical ailments, including frequent headaches, muscle tension, gastrointestinal issues, or lowered immunity leading to recurrent colds. Emotionally, veterinary nurses may experience apathy or emotional numbness, where cases that would once have prompted empathy or concern feel distant or routine. This can be particularly confronting for nurses who entered the profession out of a strong desire to help animals. Withdrawal from activities that once brought joy is another key sign. Outside of work, this may include losing interest in hobbies, avoiding social interactions, or feeling too exhausted to engage with family and friends. At work, nurses may withdraw by avoiding client interactions, limiting communication with colleagues, or emotionally shutting down during euthanasia or critical cases. Other signs include feeling constantly overwhelmed, even by manageable workloads, and difficulty sleeping, often due to replaying challenging cases, worrying about patients, or anticipating emotionally difficult shifts. Many veterinary nurses report feeling emotionally distant from animals or people they care about, including their own pets, as a protective response to ongoing emotional strain. Reduced motivation to help others may also occur, where tasks that once felt purposeful begin to feel burdensome and empathy feels harder to access. If you experience any of these symptoms, it is important to recognize them as signs of compassion fatigue rather than personal failure. Taking proactive steps, such as seeking peer support, speaking to your doctor, accessing professional well-being resources, setting emotional boundaries, and prioritizing rest and self-care can help manage and reduce the impact of compassion fatigue and support long-term well-being in the veterinary profession. In order to prevent compassion fatigue, it is essential to practice regular self-care and intentionally prioritize time for yourself, both inside and outside of work. In the veterinary nursing profession, self-care is not a luxury, but a necessary strategy for maintaining emotional resilience in a role that involves frequent exposure to stress, grief, and high emotional demand. Self-care practices may include regular physical activity, which can help reduce stress hormones and improve mood, as well as adequate sleep, particularly after long or emotionally challenging shifts. Maintaining a balanced and nutritious diet also supports energy levels, concentration, and overall well-being, which are critical in a fast-paced clinical environment. Taking time to rest and relax is equally important and may involve engaging in mindfulness, spending time outdoors, practicing deep breathing, or simply allowing yourself uninterrupted time away from work-related responsibilities. engaging in activities that bring joy or a sense of fulfillment, such as hobbies, creative pursuits, or time with loved ones, can help counterbalance the emotional toll of veterinary work and reinforce a sense of identity outside of the profession. Creating and maintaining healthy boundaries is another key protective factor against compassion fatigue. This may involve learning to say no to extra shifts when already exhausted, setting limits on overtime, or emotionally distancing yourself when appropriate in order to remain effective and compassionate without becoming overwhelmed. Recognizing personal limits and respecting them can help prevent chronic stress and emotional depletion. Regular self-reflection can assist in identifying early warning signs of stress or burnout. Veterinary nurses may benefit from checking in with themselves after difficult cases, reflecting on emotional responses, and acknowledging when work demands are beginning to feel unmanageable. Identifying specific stresses such as repeated exposure to euthanasia, high client conflict, or understaffing allows for early intervention and the development of coping strategies before compassion fatigue becomes more severe. Finally, seeking external support is an important and proactive step, not a sign of weakness. Speaking with a trusted friend, colleague, doctor, therapist, or counselor can provide emotional validation, perspective, and practical coping tools. Professional support is particularly valuable when dealing with cumulative grief, moral distress, or ongoing workplace stress. Accessing support early can help veterinary nurses maintain both their well-being and their ability to provide compassionate, high-quality care over the long term.